dinhi sa Dakbayan ug lalawigan sa Cebu ug nagpadayon ang hulga sa pag-uwan at tungod sa hinungaw sa bagyo dinhi sa Kabisayan. Welcome sa atong kisaw sa pamahaw. Espesyal ang atong kisaw sa pamahaw karong buntaga kay atong ipadayon ang pagpaminaw sa bantugan, banggiitan nga mga resource persons nga gi-provide sa ARC Hospitals sa atong pagtimaan sa Pink October. O karong buntaga ang makig-uban nato mao gyud ang mga eksperto sa breast cancer ug sa nakalilain nga matang sa cancer. Ug sila'y labing suhito sa labing bag-o nga mga teknolohiya, labing bag-o nga mga paagi, labing bag-o nga mga kahimanan pagtambal sa cancer. Ug karon itugyan namo sa atong tinuod nga tagduma, live gikan sa Dakbayan sa Pasig sa kinapusoran sa Metro Manila, ang maanyag ug lapyo nga si Attorney Aina Magpale.
Maayong buntag ug malipayong adlaw mga kasibya. Panahon na para sa Kisaw sa Pamahaw. And today, Kisaw sa Pamahaw goes international. Ngilngig ang ato ang mga guests. Karon na Leo Lastimosa kay padayon gyapon tang nagsaulog sa ato ang breast cancer activities, no? And bisan patuod og taliwa ni ining mga bagyo nga niabot kanato, hinaot unta nga mas dakong bagyo sa kasinatian ang atong makuha gikan sa ato ang mga special guests sa Kisaw sa Pamahaw.
Attorney Aina, ikay paila sa una natong bisita karong buntaga.
Ang atong suki, Leo, waylain kung dili ang medical director sa ARC Hospitals, Dr. Alex Alegrado. Maimbuntag nimo din ha. You will not just be a medical director today, but you will be an oncologist, a specialist para makashare sa imuhang expertise. Good morning.
Good morning sa inyo diha, attorney, o sa tanan na naminaw sa SibyaTV. So, ang ato ang hospital, one of the features nato diri sa ARC Hospital is really the focus on cancer treatment, diagnosis, and follow-up, no? As well as genetic na testing. So, we have affiliated with ICON. It's a cancer care group practice based in Australia, but they also have a group practice in Singapore. So I've invited one of the breast oncologist experts sa Singapore, si Dr. Shang Yip. Dr. Yip, introduce yourself. Good morning and thanks for joining us.
Hi, really glad to be part of this. Happy to see everyone and happy to help in any way today to educate and learn a bit more about breast cancer.
Thank you, Dr. Yip, and welcome to SibyaTV. Your listeners are actually based in the province of Cebu, one of the premier tourist destinations, and we hope that one of these days, when COVID-19 is no longer a challenge, you will come and visit us in Cebu.
I have been to Cebu. Alex has invited me before. I've stayed there. It's a beautiful city. It's the first place where my children have gone fishing. And they
wonderful.
So it's
wonderful.
City.
Wonderful. So it's time to go back. First destination after COVID-19 challenges are over, Cebu is it.
Yes.
Pero Dr. Alex, ang unang pangutanaan nimo, Doc, nakadungog man ba tingilngiga ining Dr. Shang Yip? Unsa may ang credentials sa Dr. Alex nanong respetado kay siya sa ninyong mga oncologists sa tibuok kalibutan?
So si Dr. Shang Yip is actually a Singaporean, and he studied in Australia to pursue his medical career, and then he also did his oncology fellowship there as well. And we worked in together in Johns Hopkins, Singapore. So the Sakuan Manggod sa Singapore, when we do our oncology practice, each one has their own special interest, or meaning to say expertise na ilang yung gihandle. So for example, si Dr. Yip is more towards breast oncology as well as genitourinary cancers, no? So in terms of maayo magunang nagyutay specialized na sad na sa oncology kay para ma-focus ginato siya ang particular aspect anang niya na cancer. Yeah, so magtinabangay namin gitawag na multidisciplinary team na muhandle sa mga pasyente na with cancer. So daghan ang mutanaw sa usa lang ka pasyente.
Leo, tuguti ko kay very humble ni si Dr. Alex Alegrado, no? And I'm sure si Dr. Yip also would like to remain in humility sa iyahang mga sa kangilngig niya. But sa ako ang pagdaig kang Dr. Yip, madaman sa kahig og pagdaig si Dr. Alegrado kay parihas man sila gigikanan. Bachelor of Medicine and Surgery na tiwas ni Dr. Yip ngadto sa University of Sydney kung diin na-awardan gani gyud siya sa Faculty of Science International Merit Scholarship para sa iyang academic achievement. Ang iyang specialist training in medical oncology didto gyud sa Crown Princess Mary Cancer Center sa Sydney, where he also did further clinical fellowship clinical research ngadto, and where he also developed clinical trials ngadto sa Sydney West Clinical Trial Center for multiple kanana ang clinical studies on breast cancer, urogenital cancer, novel cancer drugs, and pharmacogenics. Nahimo ni siyang consultant sila actually ni Dr. Alegrado sa Johns Hopkins Singapore, and also in Tan Tock Seng Hospital, mga leading hospitals ni in Singapore. Right now, they are Dr. Xiang Yip is associated with Icon Center Singapore. It's a chain, sakto ba ko Dr. Alegrado, and ang base, and they're all over the world, no? Ang pinaka base, if I'm not mistaken, is in Australia, and ARC Hospitals is also affiliated.
Yeah.
There you go. So
So mao na ato ni ina dako kay natong pribilehiyo nga si Dr. Alex ni relocate gyud. Dito na ni magbase
Yes.
sa Singapore. Ang iyang pamilya gi-relocate gyud ni Dr. Alex iyang pamilya og nag full time na gyud ni siya karon diha pagduma sa ARC Hospital. So dako kay natong pribilehiyo labi na magisgota og cancer nga duna natay atong kaugalingong anak sa Cebu nga ni ana gyud magbase dinhi sa ato og direkta na gyud nato nga makonsulta, direkta na nato nga masumbungan sa bisan unsa nato mga kalibog kay daghan pa kay mga pangutana ug mo na atong gusto nga ipatubag nila karong butaga, Attorney Aina. Dr. Yip, our question to you. Where are we in our campaign against breast cancer and the other forms of cancer? What are the latest technologies and therapeutics that we have? In short, Dr. Yip, are we winning the war against cancer?
The answer, would be, I would say yes, would be the answer. We are certainly, with regards to cancer, of all the cancers, breast cancer is probably the one that we are winning the war the most in. Not every cancer has made great breakthroughs. Breast cancer certainly is one of those that over the last decades, we have made the most advances in. Obviously, the main thing about cancer is if you were to say how are we going to win this war, most people would agree that the only way we win this war is that people are living longer and people are surviving from this cancer. And in that, if we were to see this war as a way in which we beat the cancer by people living and being cured of it, then breast cancer is leading the way. Right? Over the last few decades, it's gone from one of those cancers that were like any other cancer was probably, if you ever got it, many years ago, you would probably die of it. But now close to almost 90% of our patients who are diagnosed with breast cancer will be cured of it. And once it's taken care of, they may never have it again. So certainly it's gone from a cancer that was used to be a terminal diagnosis, one in which you got it, then you have no hope, to one in which it's become almost one of those where if you get it, we treat it like almost any other disease. We know that it's curable, that it can be beaten, and so that and we are just making, so now over the last probably 10 years, we're just making little baby steps to make sure that we are getting better and better. So every year there's a bit of improvement, a bit of new advances, new treatments available, until hopefully we get to the goal whereby eventually anybody who gets breast cancer will no longer have to be worried that they are going to die from it, but they will be able to overcome it.
Dr. Yip,
Yes, Attorney Aina.
one of the ways that we can really beat cancer is to be able to detect the cancer early and have medical intervention in place right away. How early is early for this?
Yeah, so Ina, you're absolutely right. Probably one of the big reasons why we've been able to make such wonderful strides in breast cancer, because it is one of those cancers that we can actually detect early, and the main way in which we do that is through a mammogram. You know, and we tend to most women know about mammograms, and we kind of take it for granted, you know. But you know, you compare to other cancers, there's not many other cancers that we have a simple X-ray that we can do to pick up cancer early. Breast cancer is one of those cancers that we do have the ability to do it through a simple X-ray, which we call the mammogram. So with mammograms, what we normally advise internationally, generally it's that from the age of 50 years old, every woman should go for a mammogram once every 2 years. So once you hit the age of 50, doesn't matter whether you have a strong family history, whether you're at risk or not, you should be going for your mammogram once every 2 years. Now, in certain countries of the world where we think the risk is a little bit higher in younger women, the doctors we actually advise them to go a little bit younger. So, for example, in Singapore, we know that younger women seem to get breast cancer quite early. So we actually advise them to start even earlier than 50 years old. So at the age of 40 years old, we advise women, most women, to go for a mammogram. But like I said, that differs from country to country. So the mammogram is a very simple, inexpensive test that we can do to make sure we pick up this cancer early. Other things, of course, that we do advocate or encourage is breast self-examination. And so even from the age of the early 20s, every woman is encouraged to do a breast examination once a month. And there are many resources online available that will teach you how to do a simple breast exam. And we encourage every woman to do that and to look out especially for lumps, breast lumps that persisting, you know. So if it's a new breast lump, often we don't have to worry about it. But if it's not going away after like a month or 2 months, then you have to make sure that you do not ignore it and go see a medical professional to investigate it more.
So, self-examination, akong balikon ha, self-examination as early as 20 years old. If there are predispositions in your family, nahibaw-an na nga genetically probably your parents, one of your parents had cancer, then even the mammogram should be done as early as in your 30s. But a must, definitely a must for 50 and above. That's me.
Dr. Alex, natsambahan ba lang ni Doc or masayon gyud nganong masayon man i-diagnose og tambalan ang breast cancer? Nganong niingon man si Dr. Yip nga medyo ni daog ta ining aspetuha sa atong gubat bato cancer?
Sa screening manggod, among all cancers, ang breast cancer usa sa primary na cancer na mas dali siya ma-detect o ma-screen nato. So, can you imagine a disease na pwede ra nimo ma-detect without going to the hospital, which is the kaning tawag nato breast self-examination. So when you do your breast self-examination, kung na kay makit-an dayon, then dali ra. So early access to care ba. So mahibaw-an dayon nimo kung naa. And then nay barato pag yun na test na gitawag natong mammogram, simple kay na test, just like an X-ray. No, simple ra gyud ni siya kaayo. And then ma-detect na dayon nato siya as early as we can. So why is it important na mas early detection, no? Kay mas dali matambalan. Nya kung dali matambalan, curative ang imong intent sa imong treatment sa pasyente. Dili siya itong gitawag na control lang, no? It's actually curative pa. And then sakto tong giingon ni Dr. Yip na grabe kaayo ka-advance karon ang treatment landscape sa breast cancer. Mao ni siya ang pinaka-primary na daghan kayong studies, daghan kayong tambalan ng gawas na even this year alone, FDA has approved more than 20 drugs for oncology ba. So, nindot gud kaayo ni siya na cancer na sayon niya. Dili ta angay mahadlok. So, I think it's the fear really of knowing na naataan na ang mao'y mag-limit sa mga tao na mo ato sa hospital or mo do sa self-breast exam. Pero mao lagi to atong giingon na mas maayo gyud na the early the better.
Would you say, Dr. Yip, that breast cancer is also one of the kinds of cancer that spreads easily without intervention?
Yes, you know, so breast cancer, like actually all cancers, if you do not take care of it or get rid of it in the early stages, it will spread to other parts of the body. So cancer, very typically how it works is that, it starts off as a normal cell. Mutations and multiple mutations may happen in that cell. And then eventually that cell becomes what we call a cancer cell. And often every cancer cell will have many mutations that makes it different from a normal cell. So that cancer cell then has the ability to obviously grow and spread and multiply. So it will start first with the organ where it started in. So for example, in the breast, it may start within there, but it will just keep multiplying and growing. Eventually, it will spread to the lymph nodes via the lymph vessels, and then through the bloodstream or the blood vessels and spread to other parts of the body. Commonly, breast cancer cells will like to spread to the bones, to the lungs and the liver, and even the brain. So if you don't deal with it in the early stages, meaning that if you don't remove it, then the cells will definitely spread without a doubt. So that's just how cancer cells behave. You can't take anything to stop it, unless you're even just by exercising and all that. Once the cancer cell is there, you have to deal with it and have it removed.
Another question, Dr. Yip. In order to address breast cancer, does it necessarily involve mastectomy or the removal of the breasts?
Great question. Many years ago, we're talking about more than 50 years ago, the answer would have been yes. Everybody went through a very difficult big surgery called the radical mastectomy, which was a pretty morbid or difficult surgery because they removed things like the breast, the chest wall, and all these lymph nodes. So very disfiguring and very scarring. Now that's no longer the case. In fact, it's been well proven now that if you only just remove the breast lump, what we call a white excision or a white local excision, and you do radiation to the breast, the results are just as good as removing the whole breast. So if a patient has breast cancer, in many cases, they may be able to get away without having the whole breast removed. They can just remove just the where the breast cancer is, and then do radiation. And their results in terms of surviving this and beating this cancer are just as good as doing a mastectomy. So certainly, women who are it's quite it's understandable if you worry about having the whole breast removed. But just know that there are definitely many options there available these days, which do not involve the whole breast to be removed. And most breast surgeons these days certainly would tell me that they do more wide excisions than they do mastectomies. So it's become accepted all around the world, not just in Singapore, but in America, where mastectomies or the removal of the whole breast, the actual operation is becoming less because the results of just removing the breast lump itself are so good these days.
Dr. Alex, mo na usas gikahadlukan o labing dakong babag sa labi na sa mga hamtong na ba nga mga pasyente, Dr. Alex, kay nakahibaw mangud sila dok unsa ka katong giingon ni Dr. Yip, unsa ka disfiguring, unsa ka unscientific tong, or dili not necessarily unscientific, pero mura bitog shotgun approach, Dr. Alex, sa karaan nga panahon nga chemotherapy ka, murag bahala na tingali maigo matsambahan ang mga cancer cells. Akong nadunggan gikan nimo, Dr. Alex, dihang una tang nagkasulti sa arangkada pa sa nga ang ABS-CBN Cebu nga doon na natay moderno karon nga mga teknolohiya nga targeted na mahimong dili ang tibok lawas maoy i-subject o kining traumatic kaayo nga treatment kundi i-target na ang mga specific nga mga cancer cells. Mahimo ba, Dr. Alex, imo nang hatagan og dugang detalye unsa na ba kaabante ang teknolohiya nga matod pa gani ni Dr. Yip, di na di kinahanglan nga tangtangon ang dughan sa babae o dili na sa maka-traumatic ka disfiguring and treatment?
So sakto to giingon ni Dr. Yip na ayang giingon actually kay katong gitawag nato breast conserving surgeries, no? So dili siya tangtangon gyud ang tanan nimo na breast, no, mass imong breast gyud na sa tao, sa babae, no? So ang lumpectomy pasabot nato katurang na-involve may tangtangon niya pakapina nato og radiation. So ang ilang gista gi-compare na nila sa katong yung giingon nato na radical na mastectomy. ang ilang natanaw na ang overall survival doesn't change. Parihar gyud. So, ang katong mga babae na because naamgo na siya psychological impact, it's important for women na ma-preserve ang ilang breast. So, ang atong gi-offer kani mga batanon, labi na kani mga batanon, mo ni gitawag na to breast conserving surgeries, no? Now, after that, once you remove, so mo to giingon ni Dr. Yip na mas maayo gamay pa kay matangtang mga guni mo. So ang question there is really after, what to do after, kung kinahanglan pa kag further treatment or not, no? So kana siya, nagdepende po na siya sa stage at the diagnosis of this patient. So natay, sakto na yung magiging leon na daghan kayo tang klase sa tambal karon na tailored to that particular patient. Dili na ingon na kani sila tanang breast cancer ato ni silang hatagan. So again, at mo lagi highlight karon na dili tanan breast cancer are the same. Lahi-lahi silang klase. So we will discuss that also probably later on kung giunsa na nato pag-classify sila after, no? Kung once na natay biopsy. But let me just emphasize na di man sad tanan nimo mahikapan sa imong breast cancer na dayon na siya. So ayaw kahadlok. Kay we also have what we call benign breast diseases. Although now some aning mga benign breast diseases portends a risk factor for further development of breast cancer. Pero napoy uban na wala gyud. So importante sad kayo ka na mustorya sa patient sa ato ang mga doctors para makakiba at least maput ka into ease ba na kuan din siya benign, so mag-check lang sad ta. So so early detection, we say na natay screening napagitay risk na reduction na atong gitawag na genetic profiling. Pwede na itong hibawan kung naba kay cancer risk through test mechanism like germline mutation, mga inana, no? So daghan na kayo tag mabuhat for any patient with breast cancer. So daghan kay tag mastoryahan aning breast cancer karon.
Leo, maybe for both for Dr. Yip and for Dr. Alegrado, no? What does a cancer patient expect during treatment? Because, like for example, even before they are actually operated on, what is it like? What should they expect in the different cancer treatments that will be used on them?
Okay. Look, once again, a good question. And there is no one answer to that question, Ina. And the reason being that every breast cancer is different. So these days, you know, I can't just tell every single breast cancer that they're going to need surgery, they're going to need radiation, they're going to need chemotherapy. Every single breast cancer is treated differently. And the reason why we're able to do that is that it's really oncology over the last 10 years has become what we call personalized oncology. What that means is that patients can no longer compare notes. One breast cancer patient cannot say to another, oh, why did you get chemotherapy? Why did I not need chemotherapy? Or likewise the other way around. And the reason is because we look at all the molecular biology and these days even the genetic profile of breast cancers to decide what is the most appropriate treatment for each breast cancer patient. So even we use very simple things like stage, in general, obviously, the earlier the stage of a breast cancer, the less treatment you will need, which is why we always advocate, like what we were saying early on in the show, that mammograms and breast self-examination is very important, because the earlier you pick up the cancer, then the less likely you are to need more treatments. Some patients may get away with just surgery alone. Some may need surgery and radiation. Some may need surgery, radiation, and chemotherapy. And some may need everything, meaning surgery, radiation, chemotherapy, and tablets that they may have to take for many years, what we call hormonal therapy. So how we decide is based on a lot of factors, So stage being one of them. Other things are what we call the histology or the receptor status of the breast cancer. So we look at whether this breast cancer is mainly driven by things like hormones, whether it's hormone-sensitive, or whether it may not be driven by many receptors, what we call the triple-negative breast cancers. And then these days, we even look at the genetic profile of the cancers, because some cancers, we know that genetically, they don't behave very aggressively. So these patients, where maybe like more than 10 years ago, every one of them may have gotten chemotherapy. But these days, if we know that their genetic profile shows that they are a low risk type of breast cancer, many of them may just need to be on tablets and they may not need chemotherapy. So the proper assessment of every individual patient is very important. We don't just treat every single breast cancer patient the same. Every single patient has a unique cancer, and they're treated based obviously on the best evidence for that type of cancer.
Unya, Dr. Alex Alegrado, doon ay follow-up question si Levi Cabahog, usa sa atong mga viewers mahitungod sa improved nga mga treatment system sa cancer. Nangutana siya, ang chemotherapy na minimize na ba sab kuno ang mga uncomfortable kaayo nga mga effects?
Oh, tinuod na, no? So one good news is that dili tanan breast cancer patient kinahanglan og tanan gyud surgery, radiation, or chemotherapy. Na uban na di nagkinahanglan chemotherapy. So that's one point. The second point is that ang kani atong mga chemotherapy agents karon are already very improved in such a way na di na kayo lisod i-handle sa pasyente. Ang side effects na minus na pod. And we know better now kay natay gitawag og mga pre-medications o post-medication ani mga pasyente. Instead of allowing them to suffer the consequences of the chemotherapy or the side effects of chemotherapy, from the onset, ato na silang prevent ni from happening. So kaniya to mga pasyente, dili na usahay wala na gyud ma-feel kaayo in terms of side effects like kanang mga nausea, vomiting, kanang may nana. Even kana atong gitawag na myelosuppression, kanang muubos kaayo ang white blood cell count sa pasyente. We already have colony stimulating factors to actually help in terms of improve sa ilang mga WBC count. So infection is less of an issue now compared to sa unang panahon, no? So again, not only the kind of treatment that we give, also ug unsa among gihatag, gamay na sa diyang posible na side effect. And then ang katulo na importante ani is that early assessment sa imong physician, kay personalized naman or targeted treatment ani siya. So dili na ingon na kani si patient A, moadto ni patient B, ningon din si patient A, oh kani si patient A daghan mo kay gibuhat sa iya, si patient B kay igura gyud nag-inom og hormone treatment ma. So naay daghan factors ato i-consider, no? So ako lang to gibisaya ang giingon ni Dr. Shangyip na aside from the stage, kaniya to giingon na stage 0, 1, 2, 3, 4, napotay gitawag na mga receptors, so hormone receptors, ER, PR, nasa tay gitawag na mga driver mutations sa mga HER2, mga BRCA, inana. So mo na itong mga gitawag na profiling o genetic characterization sa pasyente. Kay dako man kay siya na factor in terms of giunsa nato pag-personalize ang treatment sa pasyente.
Dr. Yip, so what are the major types of breast cancer?
Okay. So really we categorize breast cancer into three main groups. So the majority, the one that makes up about maybe 75% or 70% of all breast cancers are what we call the hormone-sensitive breast cancers. So these are the type of breast cancers. Now, traditionally, they tend to be a bit less aggressive compared to the other types of breast cancers. And they respond or they are stimulated by the female hormones. So really the female hormones, the estrogen, what acts as the food for these cancer cells. And so by manipulating these estrogens, either by suppressing the production of estrogen or blocking the effects of estrogen, we are able to often control these type of breast cancer cells quite well, just using hormonal therapy. And then we have the other two more aggressive types of breast cancers. The next one being what we call the HER2 positive breast cancers. And these kind are mainly multiply and spread because of the presence of HER2 receptors, which is a type of epidermal growth factor receptor on their cancer cells. But once again, we have many breakthroughs in this type of cancer. So this the HER2 breast cancer has almost become like there's no better way for me to say it, but almost like the better or the best, almost like the best type of breast cancer to have if you're going to have breast cancer, simply because the cure rates for these cancers are now probably one of the highest among all the cancer types. And then finally, we have the third group, probably the one that we still are making breakthroughs in, but probably most would regard as the most aggressive type of breast cancer, what we call the triple negative breast cancers. So this group tends to have no receptors that we really know about around their cancer cells. So traditionally, we could only use chemotherapy to control these cancers. But as of the last few years, finally, we have also made many breakthroughs in the treatment of this most aggressive type of breast cancer. So really just these three types, the hormone-sensitive type of breast cancer, the HER2-positive breast cancers, and the triple-negative breast cancers.
Dr. Yip, I have seen some patients that start off with breast cancer, but then it becomes metastatic. Is it also is it always that way where it starts with breast cancer and then it becomes metastatic to other organs, or is it also possible to have a different kind of cancer and then it moves to the breast? How does that work?
It's usually the first one which you mentioned. Most of the time for breast cancer, it starts off in the breast and then it becomes metastatic and spreads to other parts of the body, quite commonly the lung, the liver, the bones, and the brain. So breast cancer cells do tend to spread if they are left untreated. So now, important thing for many, I think, viewers to know is that, and we see this among our patients, the misconception that, for example, they may have had breast cancer, maybe 2-3 years ago, and they said they treated it, had surgery, and then 2-3 years later, suddenly they do a scan or they find out they have pain in the bones, and they find out, oh no, and their doctor tells them, look, it looks like your cancer has gone to the bones, and they think they have bone cancer. But often if you do a biopsy of those cancer cells, you'll find that those cancer cells are actually the very same breast cancer cells that they had 2 or 3 years ago. So they do not have a new cancer, they don't have a bone cancer, they actually still have breast cancer, but they have now a breast cancer that has metastasized to another part of the body. So often in that scenario, we often always do a biopsy to see, to exactly answer your question. If a patient presents with, a history of breast cancer a few years ago, but then now present with new cancer cells, we often will get a biopsy because we want to know whether this is a cancer cell from before, a breast cancer cell, or is this actually a new cancer of that part of the body. For example, if they've come, like I said, bone, but it could also sometimes come out with like nodules or spots in the lung. And in that scenario, we definitely would biopsy it because it may very well be that she has a new lung cancer, or she could have a breast cancer that has now come back and gone to the lungs.
Ya, Attorney Aina, pahinumdum lang sa ato mga viewers, kining ato mga bisita, duhan ni ka mga oncologist, si Dr. Xiang Yip, to ang magbase sa Singapore, to aron siya manukad sa ato pakighinabi niya. Gi-facilitate ni Dr. Alex Alegrado, ang medical director sa ARC Hospitals. Nakakuyog ni sila sa Johns Hopkins sa Singapore ug sa uban nilang mga ventures before, pero si Dr. Alex Alegrado, malipayon kumutaho ninyo, wa na, nadagit na nato din sa Subo, libalik na din sa Subo, niya na siya magbase din sa Subo. Ug nangutan na Dr. Alegrado si Fe sa Talisay City, kanindot kuno sa bag-ong mga teknolohiya o bag-ong maagi sa pagtambal gipanghisgutan ninyong Dr. Xiang Yip. Apan unsa kuno anang mao mga teknolohiya, Dr. Alex, ang available na diri sa Cebu?
So, ang kanindot ani na atong mao gining nag-affiliate kita sa mga ang mga partners sa gawas, no, kay available na gini ato ang mga treatment modalities diri sa Cebu. So di na kita mag-uol na moadto pa kita, molarga pa kita. Ang kaning mga medicine also through the affiliation nato with ICON, pwede ra sad nato siya ma-provide sa pasyente diri. So ang pasyente pwede ra diri, ang tambal na lang atong paluparon, dili na ang ang pasyente mismo. So that's a good thing about it. Let me just emphasize also and add to katong kang giingon ni Dr. Yip na despite na lisod ni kaning triple negative nato na breast cancer ba. Kay mao man gyud among usually kadlukan na mga triple negative kay wa man kayo akong term is naitambal but dili gyud siya as nindot sa uban para sa HER2 or sa ato ang hormone sensitive na mga cancers, no? So even that na natay mga tambal available diri sa Cebu.
That's good news, Attorney Aina.
Yes, kay ako Leo na adjud ko'y kasi natian ani kay sa amo ang barkada Leo mo tuo ka sa dili doon ako'y barkada nga 5 mi kabuok. upat mi kabuok
Oh.
nga kana na ang nahug nga na diagnose with form of cancer niya, stage ba. Unya ang tulogan ni ana breast gyud. And I validate Dr. Yip's comments or sharing earlier na different modalities and interventions were used on these same rather breast cancer, but they had different kinds of treatments. Just for to ask, no, because women are naturally vain. Do we still lose our hair when we have to go through chemotherapy? I mean, that's one of the things that was, they were also concerned about. And we had to look for turbans and whatnot to try and ease things. And as a matter of fact, at that time, when all three of them had cancer, we had a pictorial where we all had short hair and then we wrapped our hair, our head. So that's one of the first things. You lose your hair, you lose your eyebrows, you lose your eyelashes. You kind of lose your dignity a bit also. But then, with so much support now, this has been the coping mechanism has been addressed at least. So do we still lose our hair? Because they did. Although when their hair grew back, it was much nicer.
Uh, Look, I'll tell you, this is not just women who are vain, but men who are vain as well. So it's not just the women who are worried about losing their hair. Many of the male patients always are concerned about losing their hair as well. So it is a very understandable concern, and I have to be honest with you. If we're talking about breast cancer, most of the breast cancer treatments will still result in hair loss. Especially the best drugs that we have to cure early stage breast cancer, almost all of them will cause hair loss. Now, we have made many breakthroughs in which there are many drugs these days that don't cause hair loss. A patient may have lung cancer, colon cancer, and they can do chemotherapy and not lose their hair. But in breast cancer, the best drugs still will cause hair loss. So and certainly in the early stage scenario. In the advanced stage, then certainly we may have, like I said, we have drugs which are perhaps not so aggressive and not so strong. And for example, patients who may only need hormone treatments, then on tablets, they may not cause hair loss. But for the large majority of all early stage breast cancer patients, they will expect hair loss. Now, because we know that we expect hair loss, then what we do is make sure, like what you said, we try to support them well through that phase, understanding that it can be emotionally very difficult for a woman to lose hair. Then we have things like a lot of supportive programs, things like wigs, but also things like there are programs well known around the world, things like called the Look Good, Feel Better program, whereby we continue to emphasize to the women that even when they have lost their hair, they can still do makeup, they can still dress up well, because we know that it's important during the period when their hair is gone for them to still feel good about themselves. And when they feel good about themselves, they generally tolerate their treatments much better. And then most important, like what you already said, in almost every single case, close to 100% of women who have lost their hair, the hair will grow back. And in many cases, it will come back nicer.
Yes. That's true.
Curly hair, often that is the case when it comes back. So we reassure them and tell them that it's a temporary thing. We'll support you through the difficult time when your hair is gone. But rest assured, it will come back and you will look prettier than ever before.
Thank
Dr.
you.
Alex Alegrado, ingon si Agnes Modesta sa Baldan, sakit kaayo ang mammogram. Nangutana sab si Brenda, doon na ba kuno karoy bag-ong mammogram nga dili na sa makasakit?
So, kung nakapaminaw siya last time, no, katong interview ato sila Dr. Michelle also, o si Dr. Joven Ledesma, we actually have mammogram from Siemens na bag-o ni siya, dili na ako ngayon discomfort na lang ang term siguro, no, kay di man gyud mahimo na walay discomfort ang pag-press sa breast sa babae, but dili na siya as sakit compared to before. So so far dili lang ta atong ingon sa atong mga pasyente karon na okay biya ang pag-mammogram diri sa ERC kay dili kaayo sa sakit.
Dr. Yip, what will you reply to a cancer patient who will tell you, I will accept my fate, this is God's will?
Wow, that's so you're right. We do have patients who do present like that. Now, certainly we would look. I would talk to the patient, and I think there's once again, there's no one answer to that question, because it will depend a lot on the exact individual case scenario. Now, to a young patient with early stage breast cancer who says to me, this is God's will, I don't want to do anything about it, I would advise her that, look, she has a long life to live, and it's God's grace that God has given doctors skills to nowadays heal sick people of their diseases. So in an early stage scenario where the cancer is very curable, I would strongly encourage them about why the treatments are necessary to make sure that she never has this cancer again. To perhaps a patient who presents with an advanced stage breast cancer, who we know that perhaps at this current moment in the treatment of breast cancer, they are still incurable. I would say to that patient that, look, it may be God's will for you to have that if you think it's God's will, you have to also know that there are many treatments available that can prolong her life for many, many years. And so we would tell them about how these days the treatments for advanced stage breast cancer is extremely good. And many of these patients can live with breast cancer as if it's like a chronic disease like high blood pressure, like diabetes, where many of these patients can live for many years. And in the same way, we can keep them alive for many years with a good quality of life, with really minimal treatments, many of them just on tablets for many years and still enjoying life, spending time with their family. So the answer really is to really, once again, look at the individual scenario of each patient and to advise them and really to educate them about the treatments, because many of them will be quite surprised that the treatments may not be as difficult as they imagine it to be, and that's why they're afraid of the treatment. So proper education would be important.
Dr. Alex, the same question. Nakasugat na ba ka ini mga pasyentiha, Dok, nga mahadlok, magpatambal, o moingon nga bahala na lang ang Ginoo?
So, daghan na kayo na pud na instances, labi na diri sa diri sa Cebu. Lahi man gud sa gawas, kay usually ang mga pasyente mas more open, no? Diri sa kasagaran mayon sila na di na kumubuhat dokoy kay mamatay ra man gihapon ko, inana ba ako lang sila ingnon na ang kaning early cancer, labi na kanang bata pagyud, kanang early pa, akong ingnon na curable magud siya. Mura siya o kanang atong kung na kay sakit na high blood, na kay sakit na diabetes, na kay sakit na asthma, di ba magpatambal ka kay para di ka mamatay sa consequence or complications sa kana na mga sakit. So parihara ana ba na analogy na ang cancer karon tungod sa kanindot na sa atong mga tambal, di na siya angay kahadlukan. Mura na siya chronic disease na ato na ato yung mag-inom lang tagtambal, maintain ta ana niya na mabuhi sila with good quality of life. More often ang ilang kahadlukan magud is ilang quality of life na magunsa man lang ko na sige ko balik-balik sa hospital or maghigda na lang ko, dili na ko makalakaw. In fact, naman tay mga pasyente diri na because of the cancer mas na dili na hinon sila kalihok, dili na hinon sila ka perform sa ilang daily activities. Pero pagtambal na mo, I think ni improve gyud sila na to the point na nakabalik gyud sila sa ilang pagkatrabaho ba. Ano? Sa office, ato sa office mo trabaho sila niya. Ilang treatment kay oral treatment lang, no? So daghang yung instances na I think God gives you that particular battle because he knows that you can handle it. And I think it's also good to ask for help and tabang o understanding sa imong sitwasyon kay dili tanan hopeless na pag ito'y mabuhat.
Leo, na ay pangutana diri si nawa na hinuon. Pero ang Maria Teresa Agbo o si Doris Maturan, what is a better test kuno, ang mammogram or ultrasound? I think they they're planning to have a check. So which is better, mammogram or ultrasound or both?
Okay. Okay. I'll start first. You need both. You really need both. Now the mammogram is more uncomfortable, which is why women are reluctant sometimes to have a mammogram, whereas the ultrasound is not. The ultrasound is a very comfortable procedure, and so that's why many women will always ask us if we can just do the ultrasound. You can't. You will have a much higher chance of picking up a breast cancer if you do both a mammogram and an ultrasound. If you do only one or the other, then it becomes a lot less accurate and in picking up and finding cancer cells. Now, it's already not easy to diagnose an early stage small breast cancer cell. So really, you need both modalities in many scenarios of breast cancer to be able to pick it up. Now, if you can look at it, the mammogram is like a big picture kind of X-ray, where you're just taking a scan of the whole breast. And then if you see something that is a little bit suspicious, but you're not sure what it is, then the ultrasound comes in to focus on that part to tell us whether that's suspicious or not. Not all breast lumps are cancer. So that's why you really need both. If you only use one, then you will, number one, miss some breast cancer. And if you only use an ultrasound, you might also, the only thing is small picture, you also miss some. So really the answer to that is, to most of our patients, is you will need both mammogram and ultrasound to confirm the breast cancer for most patients.
Dr. Alex, unsa ka affordable ang treatment sa cancer diri sa Cebu karon?
So ang screening nato so before maabot ta sa pag-cancer pa gyud, sa screening lang daan barato naman kaya itong mga ultrasound ato mga mammogram. It's really affordable, no? In fact, ato ang presyo diri kay barato ra gyud kayo according to Attorney Ina, mas mahal pa gani sa Manila, no?
Tinood.
So diri barato ra gyud kayo. So screening wise okay na. Hormonal treatments are all affordable, no? Chemotherapy also, standard chemotherapy affordable. The only thing na medyo mahal pa siguro is what we call the katong mga monoclonal antibodies, katong mga immunotherapy, targeted treatment, mga olaparib, medyo mahal pa na sila kaning atong mga bag-o na tambal. Pero time will come when they lose their patent siguro nanay mga generic na available, just like the old drugs that we have now. The government is also supporting our cancer patients here. Di man sa diingon nagpabaya atong gobyerno, no? So natay gitawag na kaning sa C-package sa PhilHealth na that allocates a certain fund para sa mga pasyente na ay mga cancer. Ako ang mga storya sa akong pasyente pod kaning mga ang mga pasyente diri sa ARC na they approach mga certain organizations like kaning atong gitawag na DSWD. Sometimes moadto sila o charity sweepstakes. So na sila pambuhat ba na. And then nasa tay gitawag na PWD na discounts na mo barato gid siya by 20% tanan natambal na available diri sa atoa.
Ano ba yung package ang PhilHealth para cancer patients, Dr. Alex?
Ang ilang gitawag aning C package, but as far as I know, ang ilahang gi-providean na allocation ani kay kaning common na mga kaning common na cancer, like for example breast, colon and lung. So naa siya certain allocation. So i-monitor po na sa ato ang mga social worker na siya gitawag na means testing kung qualified ba ang usa ka pasyente ani na subsidy.
Dr. Yip, a viewer from Minglanilla, Rosie Yap, read somewhere that you developed multiple clinical trials for breast cancer, orogenital cancer, novel cancer drugs, and pharmacogenomics. What were your major findings?
So I done all these trials quite a long time ago. So at that time, very exciting. These days, you consider some of this a little bit old. So one of the things that I found, for example, 10 years ago, was there was a lot of excitement then about an old drug that we use and we still use and it's still very effective called tamoxifen. Now, tamoxifen is a fantastic drug. It's been around for 40 years, you know, and it's still one of the most effective drugs. These days, we always talk about targeted therapy in breast cancer. And everyone was very excited because instead of using chemotherapy, which kills a lot of good cells, we have targeted therapy, and targeted therapy only kills the cancer cells. And it sounded like a very new thing, like 10 years ago when people were all talking about it. But really, the first targeted therapy drug that we had was over 40 years ago, and that was the drug tamoxifen. So tamoxifen is still a very effective drug. It's cheap these days as well. Like Dr. Alex said, once they lose their patent, there are many ways we can get it at the cheap. So it's such a cheap, affordable drug that still reduces the risk of getting breast cancer by over 50%. So it's an incredibly effective drug. But you know, about some time ago, we were worried that maybe these drugs might interact with antidepressants. And so many patients are on antidepressants. So we were looking at things like whether there's an interaction between this drug and antidepressant. So that's what we call pharmacogenomics. Also things like whether patients genetically have certain genetics in their liver that they may not be so suitable for tamoxifen. So these little trials they seem small, but they are important because they pave the way to us doing bigger trials. So knowing like it paved the way when we into what I call personalized medicine, knowing that every single individual is very different, and we can look at the genetic profile of the cancers these days, even the genetics of certain patients, in order for us to determine the best treatments. So the key message these days is that every patient with cancer is an individual, and to get the best treatment, we need to personalize the care for them.
As kang ilingiga ining Dr. Siangip, Dr. Alex Alegrado, nagasalamat imong gi-facilitate makuyog nato siya karong buntag. Si Sinon Kamasura, Dr. Alex, doon siya sister nga doon ako no'y breast cancer o niya ni complicate na doon na tubig ang baga. Usa ba na sa mga komplikasyon sa breast cancer, Dr. Alex?
So, yeah, that's correct, no? Na sometimes ang ato ang mga cancer na bisagikan siya sa breast, mo spread siya sa laing organ. So we call it metastasize or spread basically. Nga usa sa komplikasyon na is mo sa lungs. Yang kanang cancer mo secrete siya mga fluids or mga tubig mo na atong gitawag na mag-pleural effusion na ang usa ka pasyente. So, static na siya na stage. However, it doesn't mean na wa sa mabuhat ana. So usually i-relieve na nato sila sa ilahang sometimes among tangtangon ang tubig kay para ma-drain to siya, and then hatagan na mo chemotherapy para mo stop na to from producing further in terms of kanang fluid sa iyang lungs, no? So mas maayo siguro na matanaw siya maayo sa ihang mga doktor nato diri sa Cebu kay para mahatagan siya sakto na advice kung unsay buhaton after.
Leo, kuryoso lang ko, Leo. Sa tanang klase nga specialization, nganong nasod man nahug diri man sa oncology ang imuhang gipili, Dr. Alex? And for Dr. Yip, my question was or is, among all specializations, why in the world did you go into oncology when it seems to be such a heart-wrenching practice? It's I've had friends. I have friends who actually go through, who are going through cancer treatment or have had cancer treatments, and I see how emotionally wrenching it is, not just for the family but also for the doctor, because some patients can be very clingy to the doctor. Why did you go into oncology? What was it that called you into the field?
Okay, I'll answer first. Two reasons. Number one, is exactly what you just said. It's such a horrible disease. You know, cancer is one of those diseases that isn't just a physical disease. Once you have it, it affects the emotional state of the patient, and even worse than that, it affects all the family members and everyone who's close to them. So there are some diseases, for example, you know, like a headache. You know, where the patient knows that they'll get better eventually, and just simple treatment, and the family is not going to be crying just because you have a headache. You know, but with cancer, they're realizing how horrible this disease is and how it affects the patient in so many different ways, both physically, emotionally, and spiritually, and as well as the family. I realized that this is one area where I had the most compassion for patients. I felt just compassion when I first stepped into an oncology ward, when seeing just the family members of patients and seeing the emotional state of patients, and compassion for these type of patients just arose. So like it's exactly what you said, it's a calling. I can't explain why, but for this particular group of patients, I just had a very special compassion for this group of patients. So it called me into this specialty, and I just ran with that calling. That's the first reason. The second reason is a little bit more self-centered for myself. It was very interesting for me. So, I just found the study of oncology incredibly exciting. The fact that we still have not beaten this disease, the fact that we haven't cured all patients, was very exciting to me. It just gave me this ideal that we could work towards, that every year seeing breakthroughs, knowing that we're getting a little bit better, it keeps me excited about what I do. Like you said, I look young. I don't think I am that young, but I think I look young because I actually quite excited. I'm still enjoying what I do. I look forward to all the breakthroughs, using new drugs, looking at doing and doing trials and all that, because it's such an exciting dynamic specialty where we are so far away from where we need to be. So all these things, I think loving what you do is really, and being interested in what you do is really important in life. It's a gift from God, right, to be able to enjoy our work. So those are the real two main reasons why I became an oncologist.
Sa ako apod attorney, it's more of, yeah, that's correct. It's the challenge na sa una manggod lisod siya sabton. So they said it takes a lot of patience to understand what's happening, no? Plus napugay family factor. So dili lang ang pasyente ay mo i-treat, apil tanan, ang husband, ang anak, ang lola, ang kuan, even gani mga igagaw, mga family friends mukuyog sa consult. So more siya holistic ang approach niya sa medicine ba, and then the true practice of medicine makita nimo sa oncology kay it doesn't only involve the disease process itself, apil tanan. So ang emotional, ang ihang spiritual, even financial, mangita mig paagi sa una unsaon man nato ni pagtabang ang pasyente na matambalan lang ba. So it was more of a challenge, and then also personal. So personal means na atong mga family sometimes na mag-suffer pog mga cancer, and we want to understand also how we can treat our family members better. So selfish siya in a way na kuan ka ng para sa family sad ba, no, na naay mga cancer sa family, but at the end of the day it's really about treating the entire breast cancer population, cancer patient population, as well as their families. So mao gyud na nag-drive nato na di kay takapuyon ba every day na moadto sa hospital, sige lang gyapon tag trabaho, tan-aw sa mga pasyente, and then you find it more of compassion, yeah, and dynamism rather than work.
Yeah, Attorney Aina, tuguti mohatag ko sa akong final question to Dr. Xiang Yip and Dr. Alex Alegrado, and I hope they won't find this inappropriate. The Vice President for Engineering of Google, Ray Kurzweil, is taking 150 pills a day so he could extend his life, because he firmly believes in 10 to 15 years we will achieve singularity, when the computers would overtake the human intelligence. And by then, we would find cure for all illnesses, including cancer. Dr. Yip, you first. Is living forever a real feasibility?
No. Look, we can bring God into this. I don't. I think it's quite clear that there is a limit to man's life. We are not wired, no matter what we do, no matter how well we live, no matter what we eat, to live forever. We will definitely, I would firmly believe and agree that we will live longer and longer as with every passing decade, that with every passing generation, that there is the potential for us to live healthier, longer lives. But certainly, I think the answer to whether we will live forever is clear that we will not live forever.
Dr. Alex, naabay forever?
Actually, akong gusto is the katuyang giingon na he's hoping na cure no sa majority of the diseases that hopefully maabot na ng panahon, no? And then that's exactly the reason and the driving factor why we are in this field, di ba? Kaya we want to find the cure and the answer. But as to living forever, I think that's a very hard question. I don't think maabot na, maybe not in our lifetime.
Can I just say, look, anyone who thinks they can live forever just has to look at 2020, right, and think how can you possibly think you'll live forever? And then this year has just completely knocked us all off our pedestal, right? Anyone who thinks they know so much about life and about health, suddenly along comes some virus and it's completely, done to the world what nothing else could ever do, right? So how can we even dare to think that when a simple virus like this has just completely stopped the whole world from moving on?
I agree.
And we will live like Attorney Aina's favorite man in the Bible, Abraham. But we need more planets to populate, Attorney Aina. Doon na kay panapos nga pangutana diha, Attorney Aina.
Dili panapos nga pangutana, Leo, but also I would like to answer your question. Ako, I do not want to live forever, at least not physically. Oh my goodness, no. But I do want to live forever in the hearts of the people that we have touched, in the same manner that our very passionate doctors have taken this specialization to heart, not just for the sake of scientific studies, but more importantly, to make sure that the patients feel the compassion from the doctors, to understand the illness and the disease, to understand the patient, to understand the family and the people surrounding that patient. So, kana Leo moy ako. I don't want to live forever. I do not want injections on my skin, on whatever. I do not want to stretch my skin. But yes, in the hearts of the people that we touch. And we are so lucky to have very young, passionate and compassionate doctors who have taken this not just as a profession but as a vocation. Thank you,
Indeed.
Dr. Yip. Much as I would want to be under your care, probably not. No, not really. Not
No.
really. Also, Dr. Alex, no, not really. But thank you. Thank you very much.
Dr. Xiang Yip and Dr. Alex Alegrado, thank you for reassuring us and our listeners and viewers that cancer is not a death sentence. Dr. Yip, your parting message to our viewers and listeners this morning.
You took the parting message from me. That was what I was going to say. But really, breast cancer is curable. So if ever if ever you thought that cancer is a death sentence, it is not. I see more breast cancer patients who are cured of the disease, much more than those who will succumb to the disease. So, and we are just getting better and better. As much as what you think, people say the cancer is incurable. No, we're getting better. We're taking baby steps, and we're getting better and better in getting rid of this disease.
Daghang salamat, Dr. Xiang Yip. Imong panapos nga mensahe, Dr. Alex Alegrado.
So sa tanan nato na nagpaminaw, like what I said always, na we are getting better in terms of how we treat patients, and we are here to support, help, and guide you through atong mga cancer patients. So ayon na mo angay kahadlok, please seek out your doctors para atong matabangan mo.
Attorney Aina magpale, imong panamilit sa atong mga listeners o viewers karong buntaga.
Sama sa naanda na, Leo Lastimosa, pasalamat nako sa ARC Hospital sa ilahang pakig-uban nato sa SibyaTV o gidapag yun nila si Dr. Xiang Yip nga ri karong buntaga. O sigurado man gyud ko, Leo, nga I will not live forever, pero sigurado sad ko na doon na pay ugma. Kini si Attorney Aina, gugma og kahayag mga kasibya.
Daghang salamat Attorney Aina Magpale, daghang salamat Dr. Xiang Yip gikan sa Singapore, daghang salamat Dr. Alex Aligrado, ang Medical Director sa ARC Hospitals Incorporated. Daghang salamat sa ARC Hospitals. Ang ato utang hangyo nila tibukbuhan na sa Setyembre mohatag sila nato mga resource persons sa Attorney Aina, ilang gi-extend sa tibukbuhan sa Oktubre para sa pagtimaan nato sa Pink October. So daghang kayong salamat sa tanan nato mga viewers o mga listeners sa ilang pag-tune in karong buntaga. Paabutan ninyo mosunod dayon ang June Perez Y. Caparis. Kini si Leo Lastimosa. Malipayong buntag kanaton tanan mga kapamilya ug mga kasibya. Thank you Dr.
Thank you.
Yip. Thank you
Thank you,
Dr.
Doc Alex.
Aligrado.
Yeah.
Thank you, Dr. Shang. Bye.
Bye.